Bioidentical hormone replacement therapy has been around in this country probably for 15, 20 years. The Europeans are a good 15 years ahead of us in this country, actually. So we're following a lot of their leads. But bioidentical hormone replacement therapy is replacing a woman's hormones with exactly the same molecular structures that the good Lord put in our bodies when we were born. They are by far the safest alternative to hormone replacement therapy that we have going right now. Much, much safer than all the synthetic drugs that have been on the market for years and years and are still being prescribed all over the country.
So in what situations would you recommend this?
Bioidenticals really should be for all women that are going through menopause or perimenopause. 13 years ago, when we started making bioidenticals here at Pitt Street Pharmacy, we were told to basically have these women on these medicines for maybe 2 or 3 years. We'll kind of get them over the menopausal hump and then we can wean them off. Now with all the study data coming out of Europe, it's actually, and we see so much positive study data, we know that these chemicals are the safest possible alternative to hormone replacement therapy. We're talking about decreasing the risk of heart attack and stroke, decreasing the risk of breast and uterine vaginal cancer. And indeed, these help with osteoporosis, just like some of the synthetic things always did. That was the only good thing synthetic hormones ever did was help with osteoporosis. But because of the risk is much, much less with bioidenticals, now we are telling women to be on these for the rest of their lives. And it really is, in a lot of women, it's a life-changing experience to finally find a medication, not only that it's safer, but that they can take that makes them feel so much better. And they know it immediately. They can tell a huge difference. And with compounding, what you're doing is tailoring a medicine to each individual's patient needs. Whereas if you buy something that's pre-manufactured from the drug companies nowadays, the doctor might have a choice of 3 or 4 different strengths to choose from. With compounding, you're actually just limitless on how many strengths you can make. So what we try to do here is tailor it to each woman's needs. We dispense about a 30-day supply at a time. We get some feedback from those women after each month, and then we kind of tailor it to exactly how her body is going to metabolize and absorb the drugs.
And so these are so natural because I understand they're made out of yam?
They come originally from yam or either soy. Nowadays, we actually, with the technology we have, the precursor molecules came from yam and soy. Nowadays, they don't actually develop them from yam and soy. We just actually clone the molecule. Now we can have a great way of just making a bioidentical molecule in the lab. So it's a little bit easier actually to produce it, a little bit less costly than actually trying to get a field full of yam or soy out.
So are there risks involved, or what should people be paying attention to?
There's still risk with hormones. I mean, hormones are, they're like any chemical. If you take too much of it, they can, be harmful. So we still have to be careful of the doses that we give women. The key with hormone replacement therapy is trying to find the lowest possible dose you can that helps alleviate that woman's symptoms without causing side effects. And because there are very few side effects with these bioidentical chemicals, it makes it a little bit easier to titrate things to find the right dose for each woman. But they do carry risk with them. The patients still have to do their at least once a year checkups with the doctors. They still have to have their mammograms. All of those things still need to be in place. We need to follow them just as closely as we possibly can.
Okay. And then the last thing, just one more time, if you could just kind of reiterate the symptoms maybe that may qualify somebody to take Bioidentical.
Most women, when they start to hit the perimenopausal years, their periods start to actually get a little bit different, irregular. The bleeding changes. Sometimes it gets a little more heavy. Sometimes it gets more light. They start missing months. They will also start having hot flashes and night sweats, vaginal dryness, dry skin. Those are the predominant symptoms of a low estrogen, of estrogen deficiency. On the progesterone side of the house, with progesterone, We'll hear women talk about having inability to concentrate, a fuzzy thinking kind of feeling, more stress and anxiety that they can't seem to deal with, and that's the progesterone part there. And we do need both of those sides, the estrogen, progesterone, in a certain ratio for each woman to balance each other out. Progesterone in our bodies is the closest thing probably to a natural valium that our body has, and it does a great job of helping us get through the day a little less stressful. But if a woman's having all the typical symptoms of menopause, where you're having hot flashes and night sweats, or during the day getting that warm feeling, flushed feeling that you feel like you're starting to explode, it makes it rather difficult to continue working or just being around and maintaining relationships. And then at night, you're waking up 2 or 3 times in the night, throwing the covers off, having to change your bedclothes and the bed sheets because you're soaking wet with sweat. Those are the predominant symptoms that we hear women having more than anything.